Now that you're familiar with the definition of mental illness, its general symptoms, causes and treatment, let us move on to the types of mental illness. Mental illnesses are classified based on the symptomatology. There are two different classification systems of mental disorders. One is the Diagnostic and Statistical Manual of Mental Disorders, or the DSM, currently in the 5th edition, which is given by the American Psychiatric Association, APA. And the other type of classification system is the International Classification of Diseases, which is in the 10th edition, that is ICD-10, given by the World Health Organization. Mental illnesses are of different types and range in different degrees of severity. They can be placed into different categories such as organic brain disorders, substance use disorders, childhood disorders, anxiety disorders, somatoform and dissociative disorders, mood disorders, schizophrenia and delusional disorders or psychotic disorders, personality disorders, eating disorders, sleep disorders, sexual disorders, etc. Some of the major types are depression, anxiety, schizophrenia, bipolar mood disorder, personality disorders, trauma, and eating disorders. The most common mental illnesses are anxiety and depressive disorders. Now, while everyone experiences strong feelings of tension or anxiety or sadness at times, a mental illness is present when these feelings become so disturbing and overwhelming that people have great difficulty in coping with day-to-day activities such as work or enjoying leisure time and maintaining relationships. At their most extreme, people with a depressive disorder may not be able to get out of bed or care for themselves, both physically and psychologically. People with certain types of anxiety disorders may not be able to leave the house or may have compulsive rituals to help them alleviate their fears. Less common are mental illnesses that may involve psychosis, that is, loss of touch with reality. These include schizophrenia and bipolar mood disorders. People experiencing an acute episode of psychosis lose touch with reality and perceive their world differently from what is considered normal. Their ability to make sense of thoughts and feelings and the world around them is seriously affected. A psychotic episode may involve delusions, which are false beliefs that can be of persecution, guilt, or grandeur. It may also involve hallucinations, where the person sees, hears, smells, or tastes things that are not there. Psychotic episodes can be threatening and confusing to other people. Such behavior is difficult to understand for people who are not familiar with it. There are many different conditions that are recognized as mental illnesses. We shall be discussing the more common types in this unit. Anxiety is a normal human emotion that everyone experiences at times. Many people feel anxious or nervous when faced with a problem at work or before taking an exam or making an important decision. Anxiety disorders, however, are different. They can cause such distress that it interferes with a person's ability to lead a normal life. People with anxiety disorders respond to certain objects or situations with extreme fear and dread, as well as with physical signs of anxiety or nervousness, such as a rapid heartbeat and sweating, etc. An anxiety disorder is diagnosed if the person's response is not appropriate for the situation, or if the person cannot control the response, or if the anxiety interferes with normal functioning. Anxiety disorders include generalized anxiety disorder, post-traumatic stress disorder or PTSD, or obsessive compulsive disorder or OCD as we call it shortly, panic disorder, social anxiety disorder, and specific phobias. An anxiety disorder is a serious mental illness. Okay, for example, people with anxiety disorders have worry and fear which are constant, and they are overwhelming and can be crippling. Panic disorder. People with this condition have feelings of terror that strikes suddenly and repeatedly with no warning. Other symptoms of a panic attack include sweating, chest pain, palpitations, that is irregular heartbeats, and a feeling of choking, which may make the person feel like he or she is having a heart attack or going crazy. Obsessive compulsive disorder, or OCD. People with OCD are plagued by constant thoughts or fears that cause them to perform certain rituals or routines. These disturbing thoughts are called obsessions, and the rituals they perform are called compulsions. An example is a person with unreasonable fear of germs who constantly washes his or her hands. Post-traumatic stress disorder or PTSD. Okay, PTSD is a condition that can develop following a traumatic or a terrifying event, such as a sexual or physical assault, unexpected death of a loved one, or a natural disaster. People with PTSD often have lasting and frightening thoughts and memories of the event, and they tend to be emotionally numb. Social anxiety disorder involves overwhelming worry and self-consciousness about everyday social situations, and the worry often centers on a fear of being judged by others or behaving in a way that might cause embarrassment or lead to ridicule. Specific phobia. Now, specific phobia is an intense fear of a specific object or situation, such as snakes or heights or fear of flying. The level of fear is usually inappropriate to the situation and may cause the person to avoid common everyday situations. Generalized anxiety disorder. This disorder involves excessive, unrealistic worry and tension, even if there is little or nothing to provoke the anxiety. Symptoms vary depending on the type of anxiety disorder, but general symptoms include feelings of panic, or fear, or uneasiness, uncontrollable obsessive thoughts, repeated thoughts or flashbacks of traumatic experiences, nightmares, ritualistic behavior such as repeated hand washing, problems sleeping, cold or sweaty hands or feet, shortness of breath, palpitations, that is irregular heartbeats, and inability to be still and calm, or physical symptoms like dry mouth, and can be numbing or tingling in the hands or feet, nausea, muscle tension, dizziness. Now, these disorders are also called affective disorders, which involve persistent feelings of sadness or periods of elevated mood states. There may be fluctuations from extreme happiness to extreme sadness. The most common mood disorders are depression, mania, and bipolar disorders. Depression and bipolar disorder can be emotionally crippling, making it difficult to live life to the fullest. Two milder versions of these mood disorders can also take a toll and can go undiagnosed. These are called dysthymic disorder and cyclothymic disorder. This mood disorder is a less severe form of depression. Although less extreme, dysthymic disorder causes long-lasting moodiness. With dysthymic disorder, low, dark moods invade a person's life nearly every day for about 2 years or more. Dysthymia is contrasted with a full major depressive episode that lasts 2 years or longer, which is called chronic major depression. Dysthymic disorder can occur alone or along with other psychiatric or mood disorders. As with depression, dysthymic disorder is more common in women than in men. A family history of mood disorders is not uncommon. This mood disorder tends to appear earlier than major depression, although it can begin any time from childhood to later life. Up to 5% of the general population is affected by dysthymic disorder, but its cause is not well understood. A combination of factors likely conspires to create this mood disorders. These factors include genetics. Genes may play a role in this disorder. Changes in brain neurotransmitters, such as serotonin, chronic stress or medical illness, isolation, poor coping strategies, and other mood disorders. These factors can feed off each other. For example, if a child always sees the glass as half empty, the child may be more vulnerable to depression, and a chronic mood disorder can sensitize the child to stress, further feeding the risk for depression. In addition to chronic low moods, common symptoms of this mood disorder would include feelings of hopelessness or helplessness, trouble sleeping or having daytime sleepiness, poor appetite or eating too much, fatigue or low energy, low self-esteem, and trouble concentrating or making decisions. A diagnosis of dysthymic disorder requires at least a 2-year history of depressed mood for most of the day on most days, along with at least 2 of the symptoms we've noted above. Although some symptoms may overlap, a person may be less likely to have weight or sleep changes with dysthymic disorder than with depression. A person may also tend to withdraw more and have stronger feelings of pessimism and inadequacy than with major depression. A person suffering from bipolar disorder may experience episodes of dysthymic or depressed mood, as well as a manic or hypomanic phase. During the manic or hypomanic stage, elevated mood, restlessness, flight of ideas, aggressive behaviors are commonly seen. Psychotic disorders, such as schizophrenia, are a group of serious illnesses that affect the mind. These illnesses alter a person's ability to think clearly, or make good judgments, or respond emotionally, or communicate effectively, or understand reality and behave appropriately. When symptoms are severe, people with psychotic disorders have difficulty staying in touch with reality and often are unable to meet the ordinary demands of daily life. They also lack insight, that is, they are not aware of their condition. However, even the most severe psychotic disorders usually are treatable, but completely not curable. There are different types of psychotic disorders. One of them is schizophrenia. People with this illness may have changes in their behaviors, and other symptoms such as delusions and hallucinations are seen very prominently in schizophrenia. These delusions and hallucinations last longer than 6 months and usually with a decline in work, school, or social functioning. Another type of psychotic disorder is schizoaffective disorder. People with this illness may have symptoms of both schizophrenia and a mood disorder such as depression or bipolar disorder. Another form of psychotic disorder is schizophreniform disorder. People with this illness have symptoms of schizophrenia, but these symptoms last between 1 and 6 months. Another type of psychotic disorder is brief psychotic disorder. People with this illness have sudden, short periods of psychotic behavior, often in response to a very stressful event, such as a death in a family. Recovery is often quick, usually less than a month. Another psychotic disorder is delusional disorder. People with this illness have a delusion. A delusion is a false or a fixed belief that is contrary to the evidence supported and includes real-life situations that could be true, such as being followed, being conspired against, or having a disease. These delusions persist for at least a month. Another type of psychotic disorder is shared psychotic disorder. This illness occurs when a person develops delusions in the context of a relationship with another person who already has own delusions. Another type of psychotic disorder is substance-induced psychotic disorder. This condition is caused by the use of or withdrawal from some substances such as alcohol or drugs like crack cocaine, that may cause hallucinations, delusions, or even confused speech. Psychotic disorders due to medical conditions are also common. Hallucinations, delusions, or other symptoms may be a result of another illness, especially a physical illness that affects brain function, such as a head injury or a brain tumor. Paraphrenia is another type of psychotic disorder. This is a type of schizophrenia that starts late in life and occurs mostly in the elderly population. Symptoms of a psychotic disorder vary from one person to another and may change over time. However, the major symptoms are hallucinations and delusions. As we've discussed earlier, hallucinations are unusual sensory experiences or false perceptions of things that actually aren't present, such as seeing things or hearing voices that aren't there, or smelling odors, or having a funny taste in your mouth and feeling sensations on your skin even though nothing is touching your body. Delusions are false beliefs that are persistent and organized and that do not go away after receiving logical or accurate information. They remain fixed even after producing evidence contrary to it. For example, a person who is certain that his food is poisoned, even if it has been proven that the food is fine, may be suffering from a delusion. Other possible symptoms of psychotic illnesses can include disorganized or incoherent speech. They may not make sense of what they talk, or confused thinking, or strange and possibly dangerous behaviors, slowed or unusual movements. There could be loss of interest in personal hygiene, or loss of interest in activities of day-to-day lives. There could be problems at school or work or with relationships. Cold, detached manner with the inability to express emotions. They may have mood swings or other mood symptoms such as depression or even mania. Eating disorders are mental illnesses that cause serious disturbances in a person's everyday diet. It can manifest as eating extremely small amounts of food or severely overeating. The condition may begin as just eating too little or too much but obsession with eating and food overtakes over the life of a person, leading to severe changes. In addition to abnormal eating patterns are distress and concern about one's body weight or shape. These disorders frequently coexist with other mental illnesses such as depression, substance abuse, or anxiety disorders. Eating disorders, when manifested at a young age, can cause severe impairment in growth, development, fertility, and overall mental and social well-being. In addition, they also raise the risk of an early death. People with anorexia nervosa are 18 times more likely to die early compared to people of similar age in the general population. Now, who gets eating disorders? Eating disorders can affect both men and women. However, they are slightly more common among women. Often, these disorders begin during adolescence or young adulthood, but may develop during childhood or even later in life. Let us now see the different types of eating disorders. Anorexia nervosa is a type of eating disorder which is characterized by an intense fear of being obese and a continued pursuit of becoming thin. Bulimia nervosa is another type of eating disorder where a person eats and then purges himself or herself in the fear of gaining weight. Binge eating disorder is another type of eating disorder, and eating disorders not otherwise specified. This includes eating disorders that do not meet the criteria for anorexia or bulimia nervosa. Binge eating could be a type of eating disorder not otherwise specified. It's the most commonly diagnosed disorder among people who seek treatment. Now, symptoms of eating disorders would be, with respect to anorexia nervosa, there is a loss of at least 15% of body weight resulting from refusal to eat adequately despite feeling hungry. There is an unnatural fear of becoming fat, and there is a distortion of self-perception. Thin anorexics may feel they are fat, and there may be a tendency to exercise obsessively. Anorexic women may go months without getting their periods, suffer weight loss, and may suffer from infertility. A significant proportion of people with anorexia will also develop bulimia. Now let's see the symptoms of bulimia nervosa. These patients first eat too much, that is, they binge on food, and then they purge or vomit it all out. Eating binges involve consumption of large amounts of calorie-rich foods. The person feels totally out of control and self-disgust during these periods. After such binges, they attempt to purge the food out to compensate for binges and to avoid weight gain. This could be done by self-induced vomiting or misuse of laxatives. A person with bulimia is usually close to their normal body weight and is less recognizable than a person with anorexia nervosa. Let's move on to binge eating disorder. Now, this is characterized by frequent episodes of binge eating. Individuals feel loss of control during these binge episodes. Now, the binge eating can lead to serious health problems and consequences such as obesity, diabetes, hypertension, high blood pressure, and heart diseases. As humans, the ability to control our impulses or urges helps distinguish us from other species and marks our psychological maturity. Most of us take our ability to think before we act for granted. But this isn't easy for people who have problems controlling their impulses. People with an impulse control disorder can't resist the urge to do something harmful to themselves or others. Impulse control disorders include addictions to alcohol, drugs, eating disorders, compulsive gambling or compulsive hair pulling, stealing, setting fire to objects, and intermittent explosive attacks of rage. Some of these disorders, such as intermittent explosive disorder, or kleptomania, that is the urge to steal something, or pyromania, the urge to set fire to something, or compulsive gambling, and trichotillomania, which is the urge to pull the hair, are similar in terms of when they begin and how they progress. Usually, a person feels increasing tension or arousal before committing the act that characterizes the disorder. During the act, the person probably will feel pleasure, gratification, or even relief. Afterward, the person may blame himself or may feel regret or guilt. People with these disorders may or may not plan the acts, but these acts generally fulfill their immediate conscious wishes. Most people, however, find their disorders highly distressing and feel a loss of control over their lives. How are they different from other disorders then? While other disorders may involve difficulty controlling impulses, that is not their primary feature. For example, while people with attention deficit hyperactivity disorder, ADHD, or in a manic state of bipolar disorder might have difficulty controlling their impulses, it is not their main problem though. Some of the health professionals consider impulse control disorders subgroups of other conditions such as anxiety disorders or obsessive compulsive disorders. Some medications for treating depression and anxiety also have been successfully used to treat impulse control disorders, particularly antidepressants known as serotonin reuptake inhibitors. This suggests that the neurotransmitter serotonin plays a role in these disorders. Now let us see the causes of impulse control disorders. What are the causes of impulse control disorders? Scientists don't know what the causes are exactly, but many things probably play a role, including physical or biological, psychological or emotional, and even cultural or societal factors. Scientists do suspect that certain brain structures, including the limbic system, which is linked to emotions and aggression and memory functions, and the frontal lobe, the part of the brain's cortex, which is linked to planning functions and controlling impulses, affect the disorder. Hormones associated with violence and aggression, such as testosterone, also could play a role in the disorders. For example, researchers have suggested that women might be predisposed to less aggressive types of impulse control disorders, such as kleptomania or trichotillomania, and men might be predisposed to more violent and aggressive types, such as pyromania or intermittent explosive disorder. Research also has suggested the connections between certain types of seizure disorders and violent impulse control behaviors. And studies have also revealed that family members of people with this impulse control disorders have a higher rate of addiction and mood disorders. Personality disorders are conditions in which an individual differs significantly from an average person in terms of how they think, perceive, feel, or relate to others. Changes in how a person feels and distorted beliefs about other people can lead to odd behavior, which can be distressing and may upset others. The major symptoms of personality disorders are being overwhelmed by negative feelings such as distress, anxiety, worthlessness, or anger outbursts, avoiding other people and feeling empty, as well as emotionally disconnected. They may have difficulty managing negative feelings without self-harming, for example, abusing drugs or alcohol or taking overdoses, or in rare cases, threatening other people as well. Another symptom of personality disorder is odd behavior. They may have difficulty maintaining stable and close relationships, especially with partners, children, and professional careers. Sometimes periods of losing contact with reality can also be seen. Some symptoms may include aggression and antisocial symptoms as well. These symptoms typically get worse with stress. People with personality disorders often have mental health problems, especially depression and substance misuse. When and why personality disorders occur is again very difficult to determine. Personality disorders typically emerge in adolescence and continue into adulthood. They may be mild, moderate, or severe, and people may have periods of remission where they function pretty well. Personality disorders may be associated with genetic and family factors. Experiences of distress or fear during childhood, such as neglect or abuse, are common. Several different types of personality disorders are recognized, and they can be broadly grouped into three categories or three clusters: cluster A, cluster B, or cluster C. Let us see the cluster A personality disorders. A person with a cluster A personality disorder tends to have difficulty relating to others and usually show patterns of behavior most people would regard as odd and eccentric. Others may describe them as living in a fantasy world of their own. An example of this cluster is paranoid personality disorder, where the person is extremely distrustful and suspicious of others. Other disorders in this cluster include schizoid personality disorder and schizotypal personality disorder. Let's move on to cluster B personality disorders. A person with cluster B personality disorder struggles to regulate their feelings and often swings between positive and negative views of others. This can lead to patterns of behaviors others describe as dramatic or unpredictable and distressing. An example of this cluster is borderline personality disorder, where the person is emotionally unstable, has impulses to self-harm, and intense and unstable relationships with others. Other disorders in this cluster include histrionic personality disorder, narcissistic personality disorder, and antisocial personality disorder. Let us now move on to cluster C personality disorders. A person with cluster C personality disorder struggles with persistent and overwhelming feelings of anxiety and fear. They may show patterns of behavior most people would regard as withdrawn. An example of this cluster is avoidant personality disorder, where the person appears painfully shy, socially inhibited, and also feels inadequate and is extremely sensitive to rejection. The person may want to be close to others but lacks confidence to form a close relationship. Other disorders in this cluster include dependent personality disorder and obsessive-compulsive personality disorder, which is different from obsessive-compulsive anxiety disorder. Mental illnesses are of different types and degrees of severity. Some of the major types are depression, anxiety, schizophrenia, bipolar, mood disorder, personality disorders, trauma, and eating disorders. The most common mental illnesses, however, are anxiety and depressive disorders. While everyone experiences strong feelings of tension, anxiety, or sadness at times, a mental illness is present when these feelings become so disturbing and overwhelming that people have great difficulty in coping with everyday activities in terms of performing everyday chores, or going to school, or college, or work, or even maintaining relationships. At the most extreme, people with a depressive disorder may not be able to get out of bed or care for themselves physically. And people with certain types of anxiety disorders may not be able to leave their house, okay, or may have compulsive rituals to help them alleviate their fears or have excessive fears toward a particular object. Less common are mental illnesses that may involve psychosis or psychotic disorders, which include schizophrenia, bipolar mood disorder, etc. People also experience an acute episode of psychosis where they lose touch with reality and perceive the world differently from what is considered normal. Their ability to make sense of thoughts, feelings, and the world around them is seriously affected. A psychotic episode may involve delusions, such as false beliefs of persecution, guilt, or grandeur. And it may involve hallucinations, where the person sees, hears, smells, or tastes things that are not present in reality. Psychotic episodes can be threatening and confusing to other people as well. Such behavior is difficult to understand for people who are not familiar with it.